Hello students. Today, we will be delving into the fascinating world of histology, specifically focusing on the intricacies of the larynx and trachea. The respiratory system plays a vital role in our daily lives, and understanding its structure at a microscopic level is crucial for medical professionals like yourselves. So, without further ado, let's dive into the embryonic development of the larynx and trachea. During embryogenesis, the larynx and trachea develop from the endodermal lining of the foregut. Around the 5th week, a ventral outgrowth from the foregut forms a tubular structure known as the laryngotracheal diverticulum. This diversion proliferates caudally, differentiating into the trachea and the larynx. The cartilaginous framework gradually forms, supported by neural crest-derived mesenchyme. As development progresses, the vocal cords, epiglottis, and various laryngeal cartilages become distinguishable. The precise orchestration of cell proliferation, differentiation, and tissue interactions is crucial for the formation of a fully functional larynx and trachea. The larynx consists of several cartilages that provide support and facilitate vocalization. The largest cartilage, the thyroid cartilage, forms the shield-like structure often referred to as the Adam's apple. Microscopically, the laryngeal cartilages demonstrate typical hyaline cartilage characteristics. Hyaline cartilage is composed of chondrocytes embedded in a matrix of collagen fibers. The presence of perichondrium, a dense irregular connective tissue layer, further supports the cartilage. Specialized elastic cartilage also constitutes parts of the laryngeal framework, such as the epiglottis. The vocal folds, or vocal cords, are essential for phonation and speech production. They are formed by layers of stratified squamous epithelium, covering a core of vocal ligament composed of elastic fibers. The ability to change the length and tension of the vocal folds enables pitch modulation. Additionally, the contraction of the intrinsic laryngeal muscles, such as the thyroarytenoid muscles, controls the opening and closing of the vocal cords, facilitating sound production. The innervation of the larynx and trachea is intricately tied to vocalization and airway protection. The superior laryngeal nerve, a branch of the vagus nerve, cranial nerve X, supplies sensory innervation to the larynx. This nerve divides into internal and external branches, with the internal branch providing sensation to the laryngeal mucosa and the external branch supplying the cricothyroid muscle. The recurrent laryngeal nerve, another branch of the vagus nerve, provides motor innervation to the intrinsic muscles of the larynx responsible for phonation. The larynx and trachea receive their blood supply from the superior and inferior thyroid arteries, which arise from the external carotid artery. Multiple branches from these arteries form an extensive anastomotic network supplying the various tissues within the larynx and trachea. Venous drainage occurs through corresponding thyroid veins, ultimately draining into the internal jugular vein. The larynx and trachea are closely related to several anatomical structures. The trachea extends from the larynx and divides into right and left bronchi, entering the lungs. Adjacent to the trachea lies the esophagus, responsible for transporting food and liquids to the stomach. Anteriorly, the larynx is associated with the thyroid gland, and posteriorly, it rests against the vertebral column. Understanding these relationships is essential for surgical approaches and to comprehend the potential spread of diseases and tumors. The laryngeal and tracheal epithelium is composed of various cell types that serve specialized functions. The ciliated pseudostratified columnar epithelium, predominantly present in the trachea, helps propel mucus and foreign particles out of the respiratory tract. Within this epithelial layer, goblet cells are responsible for the production and secretion of mucus. Additionally, scattered basal cells provide a regenerative capacity, continuously replenishing the respiratory epithelium. Diseases such as chronic obstructive pulmonary disease, COPD, and laryngeal carcinoma can cause significant alterations in the laryngeal and tracheal epithelium. In COPD, chronic inflammation and exposure to irritants lead to metaplasia of the respiratory epithelium. Squamous metaplasia and goblet cell hyperplasia are common findings. In laryngeal carcinoma, dysplasia and invasive carcinoma cells can infiltrate the epithelial layers, leading to structural and functional changes. Coughing serves as a protective reflex to clear the airways of potentially harmful substances or excessive mucus. The cough reflex originates in the larynx and trachea due to the stimulation of sensory nerve endings. Once initiated, an orchestrated series of events, involving the contraction of respiratory muscles and closure of the glottis, results in explosive expulsion of air. Repeated coughing episodes can have an impact on the larynx and trachea, leading to inflammation and structural changes. With aging, histological changes occur in the laryngeal and tracheal tissues. These changes primarily involve progressive loss of elastin and collagen, causing decreased elasticity and increased stiffness. The vocal folds may lose vibratory capacity, resulting in changes in voice quality and pitch. Furthermore, age-related changes in blood supply and cellular activity can contribute to functional decline. The larynx plays a vital role in swallowing to protect the airway from aspiration. During swallowing, the larynx elevates, and the epiglottis folds downward, creating a barrier to prevent food and liquids from entering the trachea. The coordinated actions of the larynx, tongue, and pharynx contribute to safe and efficient swallowing. The vocal cords undergo intricate development and acquire specific functions. During development, the true vocal cords form from the fusion of endodermal tissues in the laryngeal framework. The vibratory potential of the vocal cords allows for sound production and speech. Their flexibility and adjustability, in combination with airflow, permit a wide range of vocalizations. In conclusion, knowing the histology of the larynx and trachea is crucial for understanding their structure, function, and diseases. This knowledge will be invaluable for diagnosing and treating conditions related to these respiratory structures. Thank you for watching.